This is our medical negligence case by Caitlin Moorfeld, Megan Bofelli, Cassidy Johnson, and Marissa Mead.
This is a wrongful death case filed against doctors in Charles County for failing to diagnose ovarian cancer. The patient underwent exploratory abdominal surgery that resulted in a total hysterectomy, bilateral saplingo-orphectomy, left uterolysis, bilateral pelvic lymphadenectomy, and periaortic node evaluation. After the extensive surgery, the patient had 3 follow-up CT scans at Tower Radiology. The doctor found all 3 scans to be normal. In the following months, the patient went to the emergency room after the pain had continued to persist, where they received an X-ray. The X-ray showed an alarming mass, and the patient was referred to an oncologist. The patient was later diagnosed with stage 2B clear cell carcinoma. After a further look into her previous medical history, it was clear that the mass was present and visible in her follow-up CT scans and was mistaken to be an ovary.
The doctor in question failed to identify signs of disease on multiple different occasions. The patient received 3 CT scans and went to another healthcare facility for severe abdominal pain before she was diagnosed. The doctor failed to recognize her signs of disease on multiple occasions, which may have led to an earlier death 8 months later. This was a breach of the medical code, do no harm. While the doctor did not do direct harm, their failure to recognize her disease caused pain and suffering and possibly an earlier death. The doctor did not meet the standard of care that should be reasonably expected by patients with diagnosing and treating disease in particular. While the patient was referred for chemotherapy and other medical treatment, the signs of disease were misdiagnosed and left untreated in a timely manner. The doctor also breached the standard of care that is expected when they did not review the patient's medical history prior to examining the CT scans. The failure to acknowledge the patient history led to the misdiagnosis of the tumor as an ovary.
Accurate reports of Dennin's CT scans were received. Dennin underwent continued and aggressive chemotherapy along with other treatments. She eventually passed away from ovarian cancer 8 months later. If the CT scans were properly interpreted in the first place, Dennin would have had an earlier diagnosis, and Dennin would have been able to be treated for her cancer earlier and may have been able to live longer.
And as a result, the Tower Radiology was found guilty of mental anguish on behalf of the decedent's husband and daughter, loss of consortium on behalf of the decedent's husband and daughter, aggravation of pre-existing condition to the decedent's body, pain, suffering, and mental anguish until the time of her death. And then these are our references.